My name is Shahr. I'm currently working as a CT1 in Swansea Bay University Hospital, and I'm going to talk about surgical training. Let me start by sharing my screen. So here we go. So starting with surgical training is the same thing that Bilal Bhai said already, that it is really difficult to cover everything, but I think most of the things has been already covered in the previous slide. So we're gonna start with the surgical training. I know a lot of people say it's really hard to get into surgical training in UK, and you have to spend years and years before you can get a number. But I got it in my first try, so I think there is still hope. And there's a few tricks that you need to master if you want to get into training quickly, rather than just chasing what different people say. So the first thing is the same thing that we have discussed already. Uh, is the overview of the timeline is the same for all the specialities. You have to have your GMC registration. You need to be aware of the timeline when the application goes in. And then there is the same kind of assessment as for radiology is MSRA portfolio and the interview process. And then comes the last part, matching and placements that comes from. So starting with eligibility is the same thing. GMC registration, you have to request form signed, which is again similar kind of conditions. It has to be within last 3 years, and you have to spend with the consultant at least 3 months. And again, we have a experience limit here as well in surgery. Just like radiology, you shouldn't be over experienced or more experienced than 18 months in any surgical specialties that include gynae and obs as well, which is considered surgical as well. And it excludes the foundation module as for radiology. So if you have done your surgical placements in your house job, they will not be included in this criteria. Application timeline is quite similar as discussed before. The application starts end of October or start of November. You basically put in the application and you're invited for the MSRA exam in January. You get your results in February. In mid-January, you also get, based on the results, your invites, and you're invited to submit your portfolio evidences. And then in March, you will get your interviews. You take your interviews, and in the end of March and start of April, you start getting your offers, and the post starts in August. So it's quite similar timeline for all the specialties across board. As for the assessment component is concerned, we do have a weightage for MSRA here, and the MSRA is considered in two ways in surgery. First is a screening tool. You need to score a certain score to get in an interview invite. And when you get the interview invite, then in your final scoring, it will weigh at least 10% again. And then you have 30%, which comes from your portfolio, and we will discuss that later on. And then 60% is the clinical part, which has different components we can discuss later. For MSRA, the cutoff last when I applied was around 530. So it's not low. You still have to get a good score to get in, and I think it was similar this year as well. So focus on the MSRA. So for the portfolio, I think if you are thinking about surgery, the first thing to do is look at the portfolio requirement. It changes every year, and there are some basics that is written here. So it's case. You need to have certain number of cases, which is 40 cases logged onto your e-logbook and later signed off by a supervisor. You need to have a surgical audit, and that audit needs to be led by you. It's not just about being a part of audit like in other specialties. You can be just component of an audit and you can claim points. No, you have to lead the audit, and it had to be surgically themed, and it has to complete both cycles if you want to score the maximum point. It is not that hard to do, to be very honest. I did one in less than a month, so it is quite achievable. Then you have conference presentations, and the maximum point if you want to is to win a prize. They have changed this year. When I applied, if you just have presented at a national or international conference, you can claim the maximum point. But this year they have downgraded it to a B category, and now you have to win a prize at least at a national and international conference to get the maximum point. The easiest one to claim would be a taster week. Just do a 5-day taster week, and you can claim 5 points in the portfolio. And there are some changes that happened this year before I discuss this slide. Those changes are when I applied, there used to be a points system, like you get certain point for each of your achievement and it just compile into a score. And then based on that score in your cohort, you get certain points based on your percentage. But this year they have changed into grades. So it's A, B, C, D, E, different. If you have achieved different things at different level, you will get a grade, and that grade will be assessed in the interview, which wasn't the case when applied. And now they have a portfolio station where they will assess your different components of the portfolio and the grade you have given. They will recheck it, and based on their understanding, they will score you in that. So that's the major difference that happened this year. So win or lose situation is, I think the critical success factor is quite similar as explained earlier. The interview is the most important. Most of the people I know who got into training has done really well interviews. They didn't had much on the portfolio, or they just barely got into MSRA cutoff, and they still made into a training post. So interview is the most important. The second would be the MSRA. If you don't cut off get the cutoff score, there's no point of anything else. I have seen a lot of people, a lot of seniors who have been trying for years, and they have a massive portfolio. They basically score for every single thing, and they have a lot of surgical experience as well, so they can nail the interview, but they are not getting through that MSRA barrier. So MSRA is the first thing that you need to get through, and once you're over the MSRA barrier, it becomes a lot easier, as we'll discuss the competition ratio afterwards. Let's discuss the competition stats first. So for you probably see on the side that there's a 7 to 8 to 1 ratio in surgery. It's not as high as radiology, but still it's quite high. But if you consider the number, there's available seats of 650 around. The changes each year, 50 more, 50 less. But the rough estimate is 650, and the interview invites is usually double. So it's 650. 1,300 people will get invited to the interview,
2 minutes.
and that would bring down the score cutoff because there's a lot more people who will be invited for the interviews. And once you get into interview, and if you look at the math, there's 2 to 1 ratio now, which is a 50% chance of getting in. And if you think about it, there will be some people who will be really strict about their location where they want to stay. So they might give up their seat because they're not in a place where they want to go. So the ratio, the percentage of you winning or getting a seat is actually more than 50% once you get through that MSRA barrier. And after you get through the MSRA barrier, the second point is submitting your portfolios that we have discussed. Score the points, get the submission certificate signed by the consultant as required by the surgical assessment side, because they're really stingy about it, and they might not give you the exact point if it's not written in the same way. Just get it signed as they have asked for you. And once you have submitted your portfolio, the interview, you will have an interview, and the interview is a 30-minute interview. So when I took it, it was a 20-minute interview, and it has a management and clinical station. But now this year they have included a portfolio station as well. In the management station, there's usually two 5-minute stations. First is they will send you a topic, and you have to make a presentation. It won't be a PowerPoint presentation, it will be a verbal presentation, and you have to give that presentation in 3 minutes. And then there will be a 2-minute question answer session, and they will score you based on that. And the second station would be your communication and ethical station, where they will just check you the same plab two things, colleague coming late and stuff like that. Then you will go into a different window where there will be two consultants. Each consultant have one clinical scenario for you, which will be a patient management question. They won't be expecting you to make higher decision for a surgery. They want to see if you can appropriately assess the patient initially, resuscitate them, and escalate it properly. When you think that you need help, you ask for help and you escalate to your seniors. So keep that in mind, and don't rush into giving them the final management plan. Just go in a B C D manner and try to focus on the basics to score maximum points. Now this year, the third station, which has been including, which is the portfolio station. As we discussed, you score yourself a grade, and in the portfolio station, they will pick any two domains from the portfolio, whatever they like, and they'll see your verifications on that, and then they will ask you questions to check what you have done. Do you have actually done? Do you understand the process? Or it's just a fake evidence, and based on your understanding, they will score you, and that will go into your final score as well. So these we have discussed.
Sorry, you just have 1 minute left, Sharia. Thank you.
So that's the last slide. So the take homes are MSRA, the most influential factor in journey. If you go through that, the competition ratio comes from 8 to 2. Second is the interview. If you have a really good interview, then you don't have to worry much about portfolio. People with portfolio score of 20 out of 60 have got training posts. So there's always hope. Focus on these two and uh, keep going forward. I think that's the last slide. And that's the summary. If you have any questions or concern, you can always reach out to me. And I think that summarizes all of it. Best of luck. And if you are struggling or you don't understand which component of portfolio you need to focus on how to achieve it, I'm always happy to help.